The year is 2054. You are eating dinner with your family when suddenly you feel a tightness in your chest and a pain running up your arm. You rush to the hospital. The doctor comes into the room to tell you that you've had a heart attack. You wonder, how is this possible? I'm a healthy individual. I don't understand, but in reality, it is extremely possible. According to the CDC, in the US alone, every year, 805,000 people have a heart attack. And as a cardiac specialized registered nurse, I see these things happen every day. Not only heart attacks, but strokes, heart disease, and heart failure. Another reason why I chose this as my topic is because I too have been diagnosed with high blood pressure. When these things happen, you have choices between medication, and at times you can also choose to make some lifestyle modifications, which is what I chose to do. And thankfully, through these changes, I was able to really help my diagnosis of high blood pressure. I wanted to share with you how through awareness and action, we can take the necessary steps to avoid cardiac disease later in life through diet, exercise, and healthy choices. The first point I'm going to make is to be active. This includes a minimum of 20 to 30 minutes of cardio exercise a day. It doesn't have to be anything super intense. You can do brisk walking, you can go swimming, cycling. What happens is this maintains a healthy weight, and also it makes our heart stronger, which in turn lowers our blood pressure and also lowers something called cholesterol. I want to show you the difference between a healthy heart and an unhealthy heart. This is what a healthy heart looks like, and this is what our heart should look like. This is what happens when we don't watch what we eat and we don't exercise. This is a diseased heart. So that yellow stuff you're seeing is called visceral fat. It is essentially cholesterol, which is plaque buildup, and it narrows our arteries and decreases blood flow to the heart. When our heart is not getting proper blood flow, that's when we're looking at possibly a heart attack or a stroke. My number two point is to eat a nutritious diet. Fresh food choices such as vegetables, whole grains, and fruits. Try to stay away from processed food, fast food, and junk food. I know it's easy to be busy and tired and go grab McDonald's, but it is not good for our heart. Another thing I wanted to show you guys was a healthy eating plate. This is from the School of Public Health of Harvard. Our plate should have mostly vegetables and then also a lot of whole grains, healthy protein, and fruits. You don't see a lot of McDonald's cheeseburgers on that plate. The bad stuff that includes a lot of cholesterol is ice cream, muffins, butter, cheese, basically all the stuff that tastes good. Okay, and then although food choices are important, there are two other imperative points to be made. Number 3, avoid tobacco and alcohol. I don't care if it tastes like a strawberry donut, it is not good for you. These chemicals in the vapes, they cause our blood to clot, which can lead, again, to a heart attack or a stroke. According to the CDC, smoking increases our risk of heart disease by 2 to 4 times. Not only heart disease, but also a possible stroke. And lastly, but most importantly, we must address stress and mental health. Stress could possibly lead to poor health behaviors that are associated with heart disease. This includes overeating, physical inactivity, smoking, and unhealthy food choices. Stress also releases a hormone called cortisol. Cortisol promotes the buildup of plaque in the arteries. Again, remember, plaque. I suggest, making time for friends and family, practicing yoga and meditation. Pick something you like, a journal, volunteer, have a hobby, anything that relieves stress. To wrap up, a healthy diet, exercise, and stress management can prevent health problems in the future. As we grow older, it is vital to take care of our bodies and our minds. If we make some fundamental lifestyle choices, we can decrease our risk of heart disease. These steps that I've covered with you not only protect our heart health, but also provide us with tools on how to regulate stress. I hope the points that I went over today help you guys in the future. Thank you so much for your time.